Shall we move on then to item 4 on the agenda, which is the paper on putting patient and public insight at the heart of the NHS Commissioning Board. I'm going to invite Tim Kelsey to introduce the paper.
Thanks. So the board has in previous meetings been explicit about its first priority being to prioritise patients in every decision it takes and to put the two kind of core operating principles of transparency and participation at the very heart of its business. And what that comes to is a relentless pursuit of customer service and improved outcomes. And the meeting we had yesterday, certainly personally, but I think collectively reminds us of how far we have to go. What came out of that meeting for me with the community of leaders in the world of learning disabilities and autism was that, you know, there are pockets of brilliant customer service and patient engagement, but that's not the general picture, and instead really very depressing, unacceptable experience of isolation and lack of insight, you know, came across very strongly. So I think, you know, we should be celebrating where we have achieved great success, which is out there, but equally we need to move much faster than we have historically to make a reality of putting the patient voice at the very heart of what we do. And that's, of course, assisted by the fact the board has a unique and specific obligation to be the advocate for the patient and to provide leadership in that capacity across the whole health and care system. So this paper really is to initiate a routine item for the board where we will produce data by which others can hold us to account for really meeting that objective. And in this case, we're outlining some of the initiatives that we've already started even before we become, as it were, legally operational from April. Crucial amongst those, just to pick a couple of highlights out, is the commitment to genuinely trying to listen, and that's about the deployment of real-time techniques of patient and customer insight in the health and care system. The first visible iteration of that will be the commitment to rolling out what's called the Friends and Family Test. This will be an offer that's made routinely to patients and carers and others to tell us whether or not the service they're receiving is one they would recommend to their friend or family, and we're committed to seeing that rolled out across all accident and emergency departments from April of next year, but we have an ambition to roll that out across the entire context of care that we're responsible for by 2015. So that's a very big and important component of a very substantial strategy of patient and customer insight development. That's just one point. And the other point I was just going to draw people's attention to relates to plans for what we're calling a civil society assembly. This is an attempt to try and bring coherence, to bring a collective opportunity for all who are interested in supporting, commissioning and the improvement of outcomes for patients to come together and assist us in thinking through what strategies we might deploy. We're going to be publishing plans on what that will look like early in the new year for people to consider. So, I mean, broadly put, this paper is the beginning of something. I think what it says is we have an incredibly long way to go, but I hope and I believe the board has a very strong, passionate commitment to making this real. I think our enemy is tokenism, and there are pockets of tokenism in relation to the way we listen to patients and the public. We have to be honest about that, but they do exist, and we need to work much harder on making sure that isn't the style in which we operate. Because legitimacy obtained through our actions being consistent with patient need is going to be core and critical to our long-term success. So I present the paper to the board and ask the board to note the commitments that are being made and the plans for future development.
Thank you, Tim. It is an area of work of exceptional importance to us. It's right at the heart of what we want to do. Let me invite some comments from around the table. Nagib and then Victor and Kieran.
Yeah, I mean, in line with that comment about its importance, I had sort of two reactions. One was, it feels like 2015 is a very long way away, and, you know, what could we do to have something done faster? And the second thing which is related is, you know, is there some data that we can start receiving at every meeting that might be a subset? There's lots of data that exists today around the system. It might not be as well put together as we like, it might not be comprehensive, but I think if we wanted to start the principle of making this something tangible and important, if you start having some data at every meeting, it then actually gives some practical manifestation of this being important.
Okay, let's take further questions. Victor and then Peter.
I welcome this. This is a good start. I'm just aware that this is such important work in relation to how public experience things like reconfiguration and consultation, and on this, you know, we can do all this and lose it because basically the public perceive that the changes that are going to be made for all this stuff don't really involve them in any sense of the future. And I just wonder what sense you have of how this work can be used to set some real standards of public consultation that really influence in a strong sense and removes this sense that actually we're being consulted, we get the leaflet, but they're going to do it anyway, which I think is frankly deadly to our reputation. The other thing I just wanted to mention was I would like some sense of who is involved. I know that the mention of Twitter and new media, I don't tweet, so I'm interested in how do we know who is engaging, because I'm interested in the people at the sharp end of the inverse care law, and the people that can afford iPads will engage, but I'm interested in how do we know. So how do we monitor take-up and the equity? And I'm interested in what the board can do to assist this, to be more present in this process. I know we had the session with the people with learning disabilities yesterday, but I have a sense that will have a ripple effect across that sector. And while I agree with you around the issues of tokenism, there's something that we could do to be more present in this as a board, and I just wonder whether you'd have any thoughts about that.
I like what's in it. I also like things that aren't in it. So real-time feedback is great, but what about the deep dives on particular things? And you know, for a few $100K, you can do an awful lot and get true insight, which people then act on. So I'd like us to think about that. The second thing is this thing about participation as opposed to just engagement. And we committed yesterday to saying, of course, we will commit in the commissioning of services to make sure that they are inclusive for people with learning difficulties. But what about engaging with people and organisations which understand diabetes, cardiac, whatever, as we do direct commissioning, be it primary care or specialised. And the third one is, how do we get the culture of saying that we're not just going to have a civil society assembly over here and Bruce is having a clinical one with medics over there and Jane's having one with nurses over there. How do we get everybody in the room and have that contention of ideas, out of which comes the idea that none of us would have thought of coming from our own paradigm?
Let me take some of those and I'll pick it. Sorry. Oh, sorry.
Sorry, Malcolm. I just want to ask him whether actually he's thought about whether this needs to be, in a sense, segmented into the different roles that the board plays, because it's all very well for us to commit to those really important arguments and comments that we heard yesterday, but actually, as I understood it, we don't commission certainly any of those services, but we do commission specialist service. We're a big commissioner, and actually we need to be able to demonstrate before we, in our leadership role across the system, talk about the importance of doing this. We need to demonstrate that we're doing it ourselves. And I do think that there is a bit about, which goes to the heart of Jane's 6 C's really. It is about, most importantly, frankly, I will never go to a public meeting on health, or I just wouldn't have the time, and there are lots of people in that situation. But I absolutely want to be listened to by the people I deal with, and there's a bit about the kind of generality of the communication and the listening, the importance of the information that we have as a commissioning body. But there's a kind of there's a different question, and that was a very strong message again yesterday, wasn't it, about that being listened to as an individual or as a carer.
Tim, back to you.
Well, just to pick up on some of those things, all of which I completely agree with, and I didn't go through the whole document, so one or two of those things are covered, but I'll just quickly reflect on them. Just to make the point that we're moving at great pace. So April 2015, I agree, is way too far away, but that's sort of the end of it. the start of it is right now, April 2013, there will be a whole new data flows on the experience real people are having on the front line of care in a way that has never happened anywhere in this country before, really, not at scale, and frankly anywhere at all in the world. And that starts, very rapidly from April in terms of the data flows.
And we'll see some of that.
Yeah, no, right. So, sorry, but the plan is that for the next board meeting and for every meeting thereafter, there will be data relating to patient experience, which the board and the public will be able to hold us to account with. It's vitally important for me that I am, that we collectively are all held to account for this. And, warm words are not going to make any difference at all if they're not supported by, hard data on whether this is having an impact. So we will have measures of impact in February. They won't be perfect, but that will be the point at which we start publishing those. One of the things that's in the planning guidance, and I don't think it's particularly sensitive, that we're committing to is that in March we will be publishing guidance to the system, that's to ourselves and to CCGs, around how people are expected to engage meaningfully with all their constituencies. And that is about raising the bar on basic things like market research, in a sense that's widely practiced elsewhere. But we hope, and that will be something that then commissioners, including ourselves, will be assured on. So in relation to things like specialised commissioning, we have got some, I think, quite meaningful plans, which we'll be able to announce very shortly, to properly, demonstrably overcome the potential for tokenism in engagement. But that is something we're committed to in the planning guidance. Equality of access is a fundamental, real issue. And I actually can't answer that now because I think we've got a really fundamental problem with that. I think the idea of properly listening to people who are not naturally going to volunteer their participation is a really big problem for this public service and in fact for all public services. My view, and I think a view that I encourage the board to kind of challenge, is that we can do an awful lot by unleashing the power of information and technology. I think there's if we can create a multi-channel means by which people can at their own convenience talk to us, that's got to be a first step. But I think that I look forward to kind of working with the board on how we can develop that more meaningfully. So that sort of cover off some of the points that were raised, John.
Thank you. Right, well, thank you very much for the paper, and we look forward to the next iteration as we take this through.